Hi, tonight we explore the health issues we will all face as we get older. So don't go anywhere and let me show you how prevention is much better than cure. Exercise is important at any age, but especially so when you enter your senior years. Women and men over the age of 50 should be active to prevent joint problems, fractures, stress, weight problems, and some chronic diseases. As we age, we also lose muscle mass, and hormonal changes in postmenopausal women can make it difficult for older women to regain that lost muscle. Here are some tips for exercising after the age of 50. Consult your doctor before starting any exercise program, especially if you have chronic diseases such as arthritis or diabetes, high blood pressure, have had a hip replacement, back operation, or any major operation which might make exercising unsafe before a rehabilitation phase such as cardiac rehab. Always warm up before starting to exercise and take time to cool down and stretch after. Walking and swimming are optimal exercises for older adults, especially people who have yet to start a consistent exercise program. You don't want to push your body in the beginning when you start an exercise program. Instead, start exercising for 10 minutes a day and then gradually increase the time. Men and women over 50 benefit from strength training exercises. However, older adults are also at a higher risk of joint injury or overexertion, so it's important to learn proper weightlifting technique from a certified trainer if you haven't lifted weights before or aren't sure of your form. Proper form protects your body from injury and ensures you work the correct muscles. For example, never lock your joints, hold your breath, or jerk the weights. You can also benefit from joining a gym. If you've never exercised before, make sure you have a proper trainer to design and teach you an adequate exercise plan. Exercise to music classes specifically designed for older adults, such as yoga, Pilates, and calisthenics, are all safe and effective ways to keep you fit. Particularly enjoyable and social are dance classes, line dancing, ballroom dancing, or even belly dancing. Eat enough protein, which helps repair and build muscles. Women over 50 should eat at least 46 grams of protein daily, while men over 50 require at least 56 grams. Meat, eggs, fish, milk, nuts, and legumes provide lots of protein. Health issues become increasingly important after you turn 50, with women worrying about menopause and osteoporosis, and men more concerned with heart disease, impotence, and prostate cancer. Recognizing the possible signs of illness, having regular screening tests for cancer, and being aware of potential health risks will give you a start to protect yourself mentally and physically. Here are the major health concerns, along with tips for prevention. Breast cancer is the most common cancer among women of all age groups, but 80% of cases occur after the menopause. Women can lower their risk of breast cancer by not smoking, exercising regularly, limiting alcohol use, and controlling their weight. The first symptom noticed by most women is a lump in the breast, most of which are harmless but still worth getting checked. Other symptoms include persistent breast pain, nipple discharge, a marked change in the appearance of your breasts, or how they feel, or any dimpling as if the skin were being pulled from the inside. Try to become familiar with your breasts by examining them regularly. Have yearly mammograms after the age of 50. You may need earlier, more frequent screening if you have breast cancer in the family or other risk factors. Cervical cancer affects the lower part of your womb, known as the cervix. It's most likely to occur in women aged 25 to 65. Look out for bleeding between periods, after sex, or after the menopause, unpleasant smelling vaginal discharge, or discomfort during intercourse. The smear or pap test is not a test for cancer, but it identifies early changes in the cells of the cervix that happen prior to cancer. Early detection and treatment is estimated to prevent up to 80% of cervical cancers. Ovarian cancer is the fourth most common form of cancer among women. The disease largely affects postmenopausal women, with 90% of cases occurring over the age of 45. Although symptoms include indigestion, bloating, nausea, unusual vaginal bleeding, or pelvic or stomach discomfort, it is not easy to identify early symptoms. Osteoporosis is the thinning of the bones that affects 1 in 3 women, and getting older increases the risk. Linked to a lack of estrogen caused by early menopause before age 45, early hysterectomy before 45, especially if both ovaries are removed, and missing periods for 6 months or more due to overexercising or dieting. Fractures can occur more easily with osteoporosis, especially in the wrist, spine, and hip. 1 in 2 women will suffer a fracture after the age of 50. The key to prevention is as simple as a healthy and active life. Include milk and dairy products, green leafy vegetables, baked beans, bony fish, and dried fruit in your diet. Avoid cigarettes, limit your alcohol intake, and get adequate calcium and vitamin D3 at age 50. And begin bone mineral density screenings, especially if you've suffered a bone fracture. Weight-bearing exercise like running, cycling, or brisk walking for at least 20 minutes 3 times a week will also improve bone density. Menopause means the last menstrual period, the time when a woman's ovaries stop making the female hormones estrogen and progesterone. The average age at which it starts is 51. The symptoms range from hot flushes, night sweats, aching joints, vaginal dryness, and bladder problems to mood swings, anxiety, depression, and irritability. Hormone replacement therapy, HRT, can help symptoms of the menopause, as can alternative therapies and natural plant-based estrogen products. Eat smaller portions and healthier foods, and exercise more as your metabolism slows down with age. This will help prevent type 2 diabetes, high cholesterol, heart disease, arthritis, and other weight-related problems. If you're a man over 50, health issues like prostate problems, heart disease, and bladder cancer can be of particular concern. The PSA test, prostate-specific antigen, is a test that measures the level of PSA in your blood. PSA is a substance made by the prostate gland, which naturally leaks out into the bloodstream. A raised PSA can be an early indication of prostate cancer. However, other conditions that are not cancer, like enlargement of the prostate, prostatitis, and urinary infection, can also cause a rise in PSA. The higher the level of PSA, the more likely the diagnosis is cancer. However, the PSA test can also miss prostate cancer Diets high in dairy and animal fats may increase risk, whereas those high in green vegetables protect you. Bladder cancer affects the inner lining of the bladder and is the fourth most common cancer in men, especially over 50. Smokers are more at risk. Symptoms include pain during urination, blood in the urine, and a frequent desire to urinate. The loss of ability to control urination is a common problem that affects as many as 1 in 3 people. It can be easily cured or at least made manageable, and as a man, you're more at risk of one of 2 types of incontinence as you get older: an overpowering urge to urinate, followed by heavy leakage, or small leaks from a full bladder. For testicular problems, it's best to examine your testicles regularly for lumps, whatever your age. Impotence or erectile dysfunction is the repeated inability to get or keep an erection firm enough for sexual intercourse. Around 5% of 40-year-old men may have the condition, which increases with age, possibly affecting up to 25% of 65-year-olds. Anything that interferes with the blood flow to the penis may be a cause. Diabetes, kidney disease, chronic alcoholism, multiple sclerosis, and cardiovascular disease account for many cases. Generally, lifestyle changes, such as losing weight and exercise, can correct the problem. Some men may need medication, such as sildenafil, known as Viagra. 1 in 5 men die from heart disease before the age of 75. It claims more men's lives than any other disease. Heart disease runs in families, so you have a greater chance of developing it if your family has a history of the disease. Other risk factors include smoking, an unhealthy diet with too much fat, particularly saturated fat, lack of exercise, being overweight, excess stress, high blood pressure is a major risk factor. If your blood pressure has been high for a long time, you are more at risk of a heart attack or stroke. And yes, there is a male menopause or midlife crisis. It's possibly more accurate to describe the male menopause as a midlife crisis, or the andropause. Male hormones are known as androgens. Certainly, male hormone levels do not drop as dramatically as they do for women in the menopause, and symptoms include poor sex drive, changing body shape and muscle mass, weight gain, sweating, hot flushes, fatigue, and general aches and pains, accompanied by decreased stamina and mood swings, and feeling low. Reasons for these symptoms can include anemia, thyroid gland dysfunction, depression, marital problems, job dissatisfaction, financial problems, and alcohol misuse. Tonight I'm joined by Marcy Green, and she's going to let us know what's in store as we age. Hi, Marcy.
Hi, Jerry.
So tell us of all the things we can look forward to as we age.
Well, one of the most common things that I hear when people come for a massage is that they have aches and pains that they never had before. Just as they get older, they start to get aches and pains. So I'm just going to talk about some of the oils for aches and pains and arthritis, rheumatism. Number 1 oil for muscle relaxant is clary sage. It's an anti-inflammatory, antispasmodic, so it helps with cramps and muscle spasms. It eases stiff joints. It's a very warming kind of oil, and it helps with muscle fatigue. And 2 other oils that are really good for muscular aches and pains are lavender and rosemary. Lavender is a pain reliever, anti-inflammatory, helps with muscle aches and pains. Very relaxing, it's soothing to the nervous system. And rosemary is very similar. It has some of the same traits, but rosemary is a much more uplifting oil. So if you don't want to feel really wiped out, relaxed, and want to have a nap, you can use rosemary for inflammation, aches and pains. It's also a type of oil called a rubefacient, and that means that it increases the blood flow to the muscles and to the joints. And there's two other oils that are also rubefacients, which are black pepper and ginger. So black pepper, ginger, and rosemary are particularly good for arthritis and rheumatism because they increase the blood flow, they warm the muscles, and so this eases the joints for better movement. The other thing that starts to happen as you get older, your immune system just starts to get weaker. You become more susceptible to colds and flu illnesses. So there's a number of oils that can be used to strengthen your immune system and your lymphatic system. Number one oil would be tea tree. Tea tree is an antibacterial, antifungal, and antiviral oil. So this strengthens your immune systems and helps you be more resistant against contagious diseases, colds, flu, that kind of thing. The second oil for strengthening, I would say, would be eucalyptus. Eucalyptus is a more cooling kind of oil. It strengthens the overall immune system of the body and makes you more resistant to disease. It's also an expectorant. So if you have a cold and lots of congestion, build up in the lungs, eucalyptus will help you clear that. Another oil for building the immune system that you mentioned before was grapefruit. Immune system, lymphatic system, it's a diuretic, helps clear out toxic water buildup and toxins in the system, as well as juniper, which is probably one of the strongest detoxifying oils to clear out impurities in the system and help the lymphatic system work. Fennel is also a diuretic, so this helps to clear out toxins, as well as coriander. Coriander is also a very strong detoxifying oil.
And that's exactly what we need for the Christmas period, don't we?
Absolutely. You know, excess food, excess drinking, smoking, all of those things. A nice massage to detoxify all these things out of your system, and drink lots of water as well. Very important.
As we age, the risk of suffering from dementia increases. Dementia affects 1 in 14 people over the age of 65 and 1 in 6 over the age of 80. Alzheimer's disease is the most common cause of dementia. The term dementia describes a set of symptoms which can include loss of memory, mood changes, and problems with communication and reasoning. These symptoms occur when the brain is damaged by certain diseases and conditions, including Alzheimer's disease. Alzheimer's is a progressive disease, which means that gradually, over time, more parts of the brain are damaged. People who smoke and those who have high blood pressure, high cholesterol levels, or diabetes are at increased risk of developing Alzheimer's. You can help reduce your risk by not smoking, eating a healthy, balanced diet, and having regular checks for blood pressure and cholesterol. Maintaining a healthy weight and leading an active lifestyle, combining physical, social, and mental activity will also help. With this in mind, excuse the pun, I've chosen stuffed sardines for today's recipe, as sardines are one of the best sources of omega-3 fats and can protect us against heart and Alzheimer's disease. They're one of the richest fish in omega-3 fats, DHA and EPA, and these fatty acids can help control diseases including arthritis, cardiovascular and Alzheimer's disease. And an adequate intake can help improve depression and enhance cognitive powers. An ideal food for long-term brain health. Sardines are one of the few foods rich in vitamin D, which helps form and protect your bones throughout life. They are also very high in other vitamins and minerals, and one portion provides about a third of an adult's daily need of iron and vitamin E, and a whole day's requirement of vitamin B12 and selenium. They help lower bad cholesterol and high blood pressure, and regular consumption can provide up to 50% reduced risk of stroke. So be sure to make sardines a part of your healthy eating plan. Unfortunately, as we age, one of the things we lose is our muscle mass, strength, and power. This process begins from the age of 25, and the muscle is in decline, and it occurs most rapidly after the age of 50, so that by the age of 80, 50% of muscle mass, strength, and power have been lost. Both endurance exercises and strength training can help improve this, and strength training also improves bone density, which helps to reduce the risk of bone fractures. So today, I'm going to show you a few strength exercises you can safely do at home. The shoulder press is our first exercise. The primary muscles that the shoulder press will target include the front of the shoulder, the anterior deltoid, and the back of the shoulder, the posterior deltoid. The front and back of the arms and the trapezius will also be working synergistically as helpers to lift the weight. As you can see, you'll be getting an entire upper body workout with this one simple movement. I've also chosen this exercise because it's practical and will help you keep upper body flexibility when you have to reach up and get something. Elbows are bent and facing forward in line with your shoulders. Once you feel comfortable, begin the lift by pressing the arms overhead until almost fully extended. Be sure that if you're using dumbbells, you do not let them come too close together, or else this will place unnecessary stress on the elbow joint. Breathe out as you lift and in as you lower. Once elbows are extended, pause for a second and then lower them back down until your hands are about shoulder level once again. Aim for 6 to 10 reps with all the exercises, and remember to keep your back straight and your shoulders down throughout. The squat uses lots of different muscles and so is considered a full body exercise. The primarily muscles are of the hips, thighs and buttocks, as well as strengthening the bone ligaments and insertion of the tendons throughout the lower body. Squats are considered a vital exercise for increasing the strength and size of the legs and buttocks, as well as developing core strength. Start with feet parallel to shoulders and hips, knees slightly bent to avoid stress on the lower back, and lower yourself as if you're going to sit down on a chair. Keep your belly button tucked in, your chest lifted, and then slowly lift your body back to standing position. You can extend your arms to help you keep your balance. You can also slide down a wall to keep your back straight. And if you have painful knees, keep your feet turned out and only lower to where you feel comfortable. Remember not to lean too far forward and to keep your knees in line with your ankles, not your toes. Breathe out when you come down, which is the hard part, and in as you rise. Don't lower further than your hips. The last exercise I've chosen is the upright row. It works many of the same muscle groups that the shoulder press works, and so can be the upper body workout for those of you who have difficulty in lifting your arms over your head. Start in a standing position with feet shoulder width apart and the hips neutral. You'll want to make sure that you keep the hips in a neutral position the entire way through this exercise, because if you start to arch your back, you will be placing yourself at risk for developing lower back pain. Keep your arms by your side and slowly begin to lift the weights upwards, allowing the elbows to move out to the sides of the body. Continue lifting upwards until they're level with your chin. Then pause for a brief second before lowering them back down to the starting position. Think of a chicken flapping its wings as you raise your elbows. As you do this movement, it's important that you don't jerk through the action, as this can place a very high amount of strain on the shoulder girdle and could lead to a serious injury. Remember to breathe out when you lift and take a deep breath in as you lower to complete the rep. Sadly, this is the last program of this Fit for Life series, but I look forward to seeing you next year. So until then, good luck with your New Year's resolutions. I hope I've helped you make some healthy lifestyle changes, because remember, you all deserve to be fit for life. Bye.